Welcome, everyone. Thank you so much for joining me, whether it be afternoon or evening. I am so excited to be able to talk to you about one of my favorite topics, that is instrumentation. So the title of this presentation is Instrumental Insight, Mastering Techniques to Mitigate the Damage. So all listeners should apply their own professional judgment and experience with respect to all of the information provided. I do disclose that I have a financial relationship related to this activity, and I am a KOL for several different dental companies. I do want to thank Voco, as I have been paid an honorarium for this presentation. So a little bit about me. I am a dental hygienist. I received my initial training at Howard University School of Dentistry in Washington, D.C. I went on to receive my bachelor's in dental hygiene from the University of Maryland, Baltimore School of Dentistry, and then two advanced degrees, my master's of health science and doctor of health science from Nova Southeastern University. I own my own company, Dr. Joy RDH, and co-founded a company, Gel Ed, which is an educational consulting company designed to bridge the gap between education and the educator. I am on the editorial review board for Inside Dental Hygiene, advisory board for RDH Magazine. I am a member of the Maryland State Board of Dental Examiners, of the ADEX Examining Board, which is formerly CDCA Rep and CETA, and I'm actively involved with several different professional associations. So what are we going to talk about today? Our objectives. So the first objective, I want you to be able to gain a comprehensive understanding of the mechanics of tooth surface damage, particularly the effects of temporary removal of the hydroxyapatite layer during routine dental visits, particularly scaling and root debridement procedures. We're then going to revisit and master some manual and ultrasonic instrumentation concepts, including some that may not have been taught in your school. And these concepts will actually help you to mitigate some of that tooth surface damage. And finally, we're going to talk about some strategies to enhance the remineralization process post-procedure. And the focus of this is going to be to protect the tooth surface, to restore the natural defense mechanisms. And we're going to talk about some potential products that contain hydroxyapatite that could assist in this process. So, once again, we are going to focus on a critical yet often overlooked aspect of dental care, which is minimizing tooth surface damage during dental hygiene procedures, specifically the periodontal debridement. So as dedicated practitioners, our primary goal is always the health and well-being of our patients. This includes preserving the integrity of their tooth surfaces. And so today, we're going to delve deep into those intricacies, aiming to enhance your knowledge and refine your practical skills. The tooth and its resilience, we know that it faces daily challenges from various external forces. And among these, dental procedures themselves, although these procedures are aimed at improving oral health, they can inadvertently become a source of stress for the tooth surface. So the spotlight of our discussion today is the hydroxyapatite layer. And we'll talk about it a little more, but it is a vital component of the tooth anatomy. It helps to play a crucial role in its strength and durability. The temporary removal of this layer during routine visits can have lasting impacts if not carefully managed. So our duty as dental professionals, first and foremost, is to safeguard the health and integrity of our patients' teeth. So we're going to delve into the complexities of tooth anatomy and the pivotal role of hydroxyapatite, that layer, which helps in maintaining the health of the tooth. So let's take a look at the tooth here. Our teeth are marvels of natural engineering, and they're designed to perform a variety of functions essential to our health and well-being. So anything from breaking down food to the shaping of our speech, the structure of our faces, they play a crucial role in our daily lives. But what exactly are these vital tools made of? So these marvels, if you will, are made up of various different materials. And these materials help to grant them the strength, resilience, and the ability to renew themselves. So at the core of our teeth, we know lies dentin, that's a porous bone-like substance. and that constitutes the bulk of the tooth structure. So dentin is somewhat softer than the outermost layer of our tooth, but it's still incredibly durable. It contains microscopic tubes that can transmit nerve signals, providing the sensitivity that helps us avoid damage from too much pressure or extreme temperatures. Enveloping the dental is the enamel, and that is the hardest and most mineral-dense substance in the human body. Enamel's primary component is hydroxyapatite, and that's a crystalline calcium phosphate that forms a highly ordered and tightly packed structure. So this armor, if you will, helps to safeguard our teeth against the daily wear and tear of chewing, biting, and grinding. And despite its hardness, enamel is translucent, allowing that slightly yellower color of the dentin beneath to shine through and give our teeth their color. So just quickly, we know beneath the dentin lies the tooth's pulp, okay, that contains all of our blood vessels and our nerves. Then surrounding the pulp and forming the root of the tooth is cementum, and we know that's a specialized calcified substance that provides a medium for the attachment of the tooth to the surrounding alveolar bone. So understanding the composition of our teeth, it not only deepens our appreciation for these small but mighty tools, but it also underscores the importance of not only maintaining diligent hygiene, but also underscores the importance of what we do when we see our patients in the chair. So at the very heart of today's discussion, again, we're going to talk about enamel. Once again, this protective outer layer owes its resilience to largely hydroxyapatite. And as I stated in the last slide, hydroxyapatite is that crystalline calcium phosphate structure that helps to form the bulk of the enamel and the dentin. And so understanding this component is key to grasping how tooth surface damage can occur. Oops, okay. So let's talk about hydroxyapatite a little further. Hydroxyapatite is not just a passive protector. Again, it actively engages in the remineralization process, constantly exchanging minerals with saliva to repair minor enamel erosion naturally. However, its strength also makes it vulnerable during dental procedures. Again, it can be temporarily removed or damaged, and it can lead to potential tooth surface vulnerability. So scanning electron microscopy here, these images reveal the intricate topography of not only human enamel, but it also shows what it would look like for a mouse. And what you see in the human enamel is that there's a tightly intertwined network of apatite crystals, and they're organized into cylindrical structures known as enamel prisms or rods. And you will see here in contrast that the mouse enamel displays distinct subunits within each prism, each clearly demarcated from one another. So I find these pictures rather fascinating myself. So during routine dental visits, what are we using? What are we doing? So the procedures like the scaling and the root debridement, we know that they're essential. They're essential in helping our patients maintain health. And again, inadvertently, if they're used incorrectly, if you're using the wrong tool, if you're using the wrong technique, or using certain tools with an improper procedure, these tools can lead to the temporary removal of that hydroxyapatite layer. So we need to be able to handle these instruments with precise care. What we want to avoid is scratching or eroding that vital defense layer and exposing the tooth to harm. So what we want to do is we want to minimize the damage. So that's what the good news is that with a comprehensive understanding of the techniques involved and best practices in patient care, we can mitigate the risk of tooth surface damage. And so the next part of this presentation is dedicated to exploring what are some of the ways that we can do, or what are some of the things that we can do to refine our scaling and our polishing methods to preserve the integrity of that hydroxyapatite layer. By honing our skills and knowledge, we can certainly help to safeguard our patients' smiles, ensuring their dental health remains robust over the years. So I want you to take a look at these pictures, and I want you to consider what are some of the tools that you would use. Would you use the same tool? So what I see are various levels of disease from one picture to the next. I see recession. I look at the gingiva. I'm looking at the type. It's, it's rolled. In some pictures, it's inflamed. Are you going to use the same tools? Okay. What are some of the other things that you would consider? Again, so you might want to consider the patient's medical history. I know the popular thing to use for a lot of clinicians is ultrasonics only or air polishing only. But what happens when your patient is contraindicated for those procedures? Take a look at the gingiva. Does your patient have any known allergies? What can your patient tolerate? So it's important to note that you have patients with sensory issues. And so it's not that they're being difficult. Sometimes they present with mental health challenges or other difficulties that make it impossible for them to tolerate some of the noises that are associated with powered instrumentation. Do you have certain tools at your disposal? Okay, so I've seen some really interesting pictures online. I'm a fan of temping, and what I've seen online is you have temps that go into offices and they show what they've been given to not only do routine care, but to also do some of the scaling and root debridement. And oftentimes it's just a sickle and a mirror. Okay, so just imagine this picture over here to the far right. Can you imagine being able to treat that patient with just one instrument? You also have to consider training. Graduated, so I would call that more of a novice clinician. Are they going to be as skilled to perform the necessary procedures to get the best outcomes for patients with advanced deposits? So there are a number of things that you definitely can consider. In addition, do you consider your tooth morphology? So I know some of you, back when I went to school, it was called dental morphology. That was the name of my class. And I have a little PTSD, I'm not going to lie. But it's really important that we consider tooth morphology. Do we consider crown length and width? Do we consider the root complex? Do we consider the degree of separation? Sometimes we have patients that present to us and they have furcations, and the furcation may be 0.5 millimeters wide, but you're using an instrument that's 0.7 millimeters wide. So we have to consider different things when we are trying to mitigate damage while providing the best care to our patients. Are you practicing Stone Age dental hygiene? And so scaling and root debridement procedures, of course, we know that these are essential procedures, have traditionally, when they were first introduced, were associated with application of significant pressure. And this can be damaging to teeth. And this is partly due to the nature of the procedure itself, which we know aims to debride all of the hard and soft deposits from the tooth. And then the tools, the original tools designed for this procedure or these procedures, while effective, have historically necessitated that clinicians apply considerable pinch pressure to effectively reach and debride the targeted areas. So such pressure, especially when it's excessive, doesn't come without consequences. It can lead to the removal of not only the unwanted biofilm and calculus, but also a portion of the enamel or cementum, in addition to that protective layer of teeth. So there are some people, I like to say in dentistry, we learn something, we hold on to it, and we don't like to change the way that we do things. And so there are some people who may have graduated, let's just say in 1970, and they haven't changed the tools or their techniques. So it's going to be important that your why should evolve, your techniques should evolve, because so many things have changed in dental hygiene since that time, and certainly the tools have changed. So there's so many different risks associated when we are applying unnecessary pressure, when we haven't evolved our tools and techniques. And so the realization of these potential risks has spurred the innovation of certain dental tools and techniques. So today's instruments are more ergonomically sound. They're designed to reduce the need of that excessive force. They aim to help protect both the tooth and the clinician while still allowing the clinician to perform effective scaling and root debridement. Advancements reflect the growing understanding of the delicate balance required in dental care. So we have to strike a balance, and we often are working in a blind. We have to strike a balance between a thorough debridement and preserving the integrity of the patient's natural dentition. So when you are performing scaling and root debridement procedures, I don't think you should just go along with things like you're flying in the wind. You should always have a rationale for what it is that you're doing. Why are you doing what you're doing? Why have you decided to select the tools that you have included in your armamentarium? Make sure that whatever strategy you incorporate or the technique that you implement is evidence-based. All of your strokes should be meaningful. So, guys, I get it. It's Friday, it's 5 o'clock, it's happy hour, and, your 4 o'clock patient is just walking in the door at 5 o'clock, and your employer says you still have to see that patient. Your strokes may not be meaningful. So you just don't want to be in the pocket and your instrument is going every which way and you don't know what you're removing. Your strategy and technique should take into consideration preserving your body, especially your hand, and of course, always keeping ergonomics at the forefront. By preserving your body and your hands and keeping ergonomics at the forefront, you're actually helping to mitigate damage, believe it or not. So with your treatment goals, the two things that I want to focus on, mainly three, is that number one, yes, biofilm is important. We've been inundated with it, and we absolutely know that we must control the biofilm, remove the biofilm, but we cannot forget about the plaque retentive factors like calculus. We still need to go after that calculus. In addition, we want to be able to create a biologically acceptable root surface, but we also need to be able to conserve tooth structure. We do not want to remove hydroxyapatite from the tooth, and unfortunately it happens, but we don't always want to completely strip it. So let's talk about how we can safeguard our instrumentation approach. I like to say protection today or progress tomorrow. So let's talk about some things. Number one, do you explore? Exploring is not beneath an experienced clinician. So assessment before proceeding with any treatment should guide every clinician's action. So specifically, exploring is important in identifying the presence of hard deposits. And the rationale behind this exploratory step is straightforward. Detecting hard deposits allows clinicians to tailor their treatment plans to the specific needs of each patient. If hard deposits are found, targeted interventions can be planned with precision. So there's that precision word again. However, this raises a vital consideration. If no hard deposits are discovered during the initial exploration, should we still proceed with treatments that necessitate the application of significant pressure using a blade? And so the answer to this leans towards caution and prudence. Applying a blade with substantial pressure on teeth that lack hard deposits not only contradicts the principle of minimizing harm, but it also exposes the tooth enamel to unnecessary risk. Again, the enamel, though highly durable, is not impervious to damage from excessive physical force. So therefore, in cases where hard deposits are absent, alternative treatment modalities could be considered. I do want to add that we should always adopt this cautious approach and consider this approach. Remember, as clinicians, it's really our duty to uphold and protect and enhance the oral health of our patients. So we should always tailor our methods to the specific conditions presented by the patient. This will help to optimize the outcomes, but also will help to minimize the risk of inadvertent harm to the tooth. Let's talk about pressure. Okay, so pressure, I would say when I graduated, is not something that I considered, and I'm a heavy-handed person. So it wasn't until later on in my career when I really started to study instrumentation that I really started to focus on pressure. In addition, I started to have problems with my hand. So what we know about pressure is that it plays a critical role in determining the extent of tooth surface damage during manual and ultrasonic scaling. This can also play a part in polishing as well. The application of pressure, if not carefully managed, can lead not only to the removal of calculus, but also, once again, a thin layer of that enamel and cementum. And I've said this, we've also known that the excessive force, that excessive pressure can also cause damage to the surrounding gingiva, leading to recession or other types of lesions. So what are some of the general effects of pressure? What can it cause? Excessive pressure can cause microscopic cracks and fissures that develop on the tooth surface. And again, this is due to that excessive mechanical force. So this can act as a potential site for bacterial colonization. So we need to consider that as well. Over time, repeated application of high pressure can contribute to accelerated wear and tear of dental tissues, undermining the structural integrity of the teeth. And so we want to mitigate these risks. We should always use the minimal amount of pressure needed to effectively carry out the procedures while also using modern dental instruments designed to optimize the removal of deposits while minimizing pressure on the tooth surface. Let's talk about polishing really quick as well. We know that there are abrasive agents that are used in polishing paste. When we combine that with high pressure, that can also wear away the protective surface layer, that hydroxyapatite layer, and this can thin the enamel over time. So we need to be careful with that. There are always three pressure forces at play when we're using our manual and our ultrasonic instruments. Number one, that's the pinch pressure. That's how tight we're holding our instrument between our thumb and our index finger. There's the fulcrum pressure. So that's the amount of pressure that we apply against whatever surface we are trying to stabilize our hand on, and that's usually with the ring finger. And then there's that lateral pressure. So that lateral pressure is the amount of pressure that we apply the working end of the instrument against the tooth. And all of these pressure forces must be balanced throughout any stroke, whether it be manual, ultrasonic. It has to be balanced in order to be effective with the task at hand. So my question to you is, how are you monitoring your pressure? The type of stroke you use will guide or should guide the amount of pressure you are applying. So if you are using, or I'm not going to say if you're using an assessment stroke, if you are assessing, my hope is that you're not applying the same amount of pressure you would use, let's just say, if you were removing tenacious deposits. We have to be mindful of that. Sometimes we are just in a zone and we're just going through the day and we're busy and we have lots of patients and everything, we just become like robots. And it's the same amount of pressure, whether there's a lot of deposit, whether there's a little deposit, whether we're assessing, whether we're probing, whether we're exploring. So we have to be mindful that we are taking the types of strokes that we're using and the types of procedures that we're doing into consideration. I think I just went backwards. Let me go forward. Okay. So let's talk about fulcrums and lateral pressure. Here we go. So this is going to be very important. This is one of the areas where I feel like a lot of damage can be caused if we're not mindful of that. So when we talk about fulcrums, we know that it offers stability. A question that I often like to ask when I'm doing hands-on courses is, where should your fulcrum be? And I hear a variety of answers, but your fulcrum should be as close to the working area as possible. And that's going to be different from everyone. I'm 5'2", my hands are relatively short and stubby. My fulcrum may not be the same as someone who may be 6'5" with really long fingers and a really big hand. And that's one of the things that I think, 50 plus years ago, everyone was taught the same fulcrum, regardless of the differences in hand size. So our fulcrum is going to enable pressure against the tooth. Ideally, when we are working, especially with hand instruments, your intraoral rests are going to be most effective, especially when your fingers stay close and near the working end of the instrument. The problem with this, however, is that it limits access to deep periodontal pockets. And if you get there, you may not always have the proper angulation. So this goes to my next point. You want to avoid fulcrums that are too close if you're trying to access those deeper pockets. Sometimes individuals with larger hands will have to split a fulcrum, or even if you have a smaller hand, depending on the patient, how they can hold their head, the anatomy in the mouth, you may have to split your fulcrum. But we need to do this because that can increase finger fatigue. And what we will discuss here shortly is that when your fingers are fatigued, you are going to be more likely to have ineffective deposit removal. So you're going to burnish it. And what we know is that when you have burnished deposit, you're going to apply more pressure to remove it and inadvertently remove more of that hydroxyapatite layer than you should. So what I would say about fulcrums, and this is often not taught in schools, is that you have to employ the use of alternative fulcrums. I don't even like to call some of these advanced. They're just alternative fulcrums, okay? You want to employ the use of these alternative fulcrums. This will help you to keep the lower shank parallel to the tooth's long axis. These alternative fulcrums will also help you to control your strokes, depending on what it is that you're doing. If you're removing tenacious deposits or you're trying to get into deeper pockets, employing these alternative fulcrums will be very beneficial. So for example, the extra old fulcrum, that's very helpful, especially when you're trying to reach those terminal molars on the maxillary. People with larger hands may want to implement a cross arch fulcrum. Finger on finger helps to give you some added stability, especially when you are trying to remove tenacious deposits. And your finger on finger is going to look different depending on your hand size and where you are in your mouth. So your finger on finger doesn't necessarily look like mine. And then, of course, you have opposite arch. Now, again, as I stated, the best fulcrum is the one that's going to be as close to the working area as possible. So when you go to these alternative fulcrums and you're trying to remove tenacious deposits, I believe that you need to support that or enhance your fulcrum. Some people will say you need to reinforce it. And so once again, this is going to look very different depending on the area of the mouth you're working in, the size of the clinician's hand, how the clinician is positioned around the patient. Your dental anatomy is going to play a role as well. I really encourage the use of an enhanced, supported, or reinforced fulcrum when you are trying to remove those tenacious deposits, because it's going to help prevent the burnishing of the deposits. So you can do finger on the shank or thumb on the shank, pinch the shank, or you can do thumb to thumb. In the picture here, I'm thumb to thumb. And because my hands are smaller for this particular area, I was also able to put my finger on the shank. So this is, again, really helpful when you're trying to remove those tenacious deposits. It's helping me to keep the instrument stable. My strokes are going to be more controlled, and I'm going to be able to remove those deposits more effectively. So we have to be able to balance that pressure. That's the key. I always joke and say we only know one pressure in dental hygiene, and that's lots of pressure. So, removal of calculus from the tooth surface, it is an art and a science. It requires precision. It requires patience and a deep understanding of tools and techniques at the clinician's disposal. But I do want you to give yourself some grace, even with the best intentions, with all the skills that you have. The challenge of unbalanced pressure and the use of incorrect stroke types during scaling can inadvertently lead to the problematic outcome known as burnished deposits. It can also lead to ineffective deposit removal. So I've talked about burnished calculus a little bit, so I just want to highlight it here for a minute. It is important to note that burnished calculus, it doesn't appear overnight. Your patient just doesn't wake up one night and say, oh, burnished deposit, unless they are purchasing off-market tools from eBay and they're going in their mouth with periodontal instruments and trying to remove the deposit themselves. A burnished deposit is a deposit that has had its outermost layer removed, so the surface is now smooth. And there are a number of things that can cause burnished deposit. The incorrect use of ultrasonics, and so I think that's probably one of the biggest misnomers in dental hygiene or dentistry, that you use ultrasonics and you have perfect scaling. And in fact, if you're not employing the right tip or the right technique, you're burnishing that deposit. Using dull or worn instruments, so your instruments just don't last forever, whether they're stainless steel or sharp and free. Using a relaxed grasp, and all of the things I'm talking about here are basic instrumentation principles. The lack of pressure for the tenacious deposits. So we just talked about the lateral and the fulcrum pressure. the incorrect use of a fulcrum. So if you have to split your fulcrum for tenacious deposits and you don't enhance it or support it, if you have improper angulation, incorrect use of the blades, improper strokes, so you're doing more of a finger flex versus a wrist rock, and depends on the situation. And if you're experiencing some hypermobility. So those are all things that lend themselves to burnished calculus. So why is burnished calculus bad? For a number of reasons, but it attracts biofilm and it calcifies and hardens over time. And actually it locks that deposit into the dental surface. So once it's locked into the surface, you got to go back with a lot of pressure to remove it. So the challenge of addressing burnished calculus extends beyond its immediate implications for oral health. Given its smooth and hard nature, removing burnished deposits requires significant effort. Again, many clinicians are really going to find themselves compelled to apply that extra pressure during scaling in an attempt to dislodge the burnished deposits. And this endangers the integrity of the enamel and potentially the surrounding tissue. So the issue is exacerbated when clinicians are working with instruments that are not optimally sharp. As dull tools, as I stated in the slide, that what causes burnished calculus, dull tools necessitate even greater force to achieve the same effect. And once again, that heightens the risk of damage to the tooth surface and, most importantly, patient comfort. So what are some of the other factors that influence pressure? Okay, there are a number of factors that influence pressure. Have you ever considered your glove fit? Glove fit absolutely will impact the amount of pressure that you are, it mainly affects pinch pressure. So remember, pinch pressure is how tight you hold your instrument with your thumb or your index finger. Gloves that do not fit well will restrict or impinge your movement. You are going to apply extra pressure. So not only are you burnishing deposit, you are damaging the surface of the tooth, but you're also predisposing yourself to developing a musculoskeletal disorder. So you need to have well-fitting gloves. You need to don well-fitting gloves. Well-fitting gloves will contribute to your hand comfort. It helps, or they help with your orientation and dexterity, absolutely helps to balance your pressure and actually improves your tactile sensitivity. So you need to consider your glove fit. Fingernails. So there is not any day that I can log onto social media and not see someone, maybe it's just my algorithm, but I guess fancy nails and long nails and acrylic nails, gel nails, press-ons are now on steroids, where I'm looking at people and I'm thinking they've had this well done manicure and they're actually wearing press-ons. But it's important in our profession to keep our nails short. So we need to be able to maintain our fingernails at a functional length. This allows us to fulcrum properly. Okay, when fingernails are too long, it is impossible for you to fulcrum properly. And so that's going to compromise your movement. You're not going to be able to keep the blade or that shank angulated and parallel to the long axis of the tooth. And when that happens, you could potentially burnish that deposit because you can't get the proper fulcrum, or your movements are compromised. You may be applying additional pressure in order to remove that deposit. So yes, ladies, gentlemen, we need to be able to keep our fingernails short. Our positioning, when you're out of position, you can inadvertently apply extra pressure. And so it is always a challenge to stay dental neutral, especially if the room that you are in doesn't lend itself to proper ergonomics, okay? Ideally, we want to keep our hands, wrists, and arms in neutral, or we can go within 20 degrees outside of neutral. But anything outside of that, we are actually going to predispose ourselves to a musculoskeletal disorder. And here's the thing, guys, when your body is hurting, you're more focused on your body hurting and you're less focused on balancing that pressure, and you're less focused on minimizing tooth surface damage. So we need to be aware of our positions. One thing that's I know that wasn't taught I graduated in 97, I'll just put that out there. And at that time, we weren't really taught to go beyond 12 o'clock. And so what I want to encourage people is that, start thinking unconventionally. It is okay to extend your position beyond the traditional 12 o'clock stance, unless you're in a room that doesn't allow you to do that. Most of our treatment can be conducted from an 11 or 12 o'clock position. For those of you who are left-handed, it would be 1 to 11 o'clock. It is really important to minimize that side sitting, okay? That creates awkward postures of the torso. And again, that can lend itself to your hand being out of place or your body starting to hurt. But don't be afraid to extend your clock position. Right-handed people, sometimes I go all the way up to 3 or 4 o'clock. For a left-handed individual, it would be 9 or 8 o'clock. So these are things that you can practice if you have a typodont at home, or if you work in an office with your employer, or maybe another hygienist. But these are things that I would highly consider. But your position actually will impact the amount of pressure that you are applying. Your grasp. So this is another thing. It is really important to understand that when you are trying to remove a hard deposit, that you should be using a debridement grasp. And what is that? That means you're applying a little bit more pressure, and that index finger is going to crack back, okay? That's going to be important. If you are using a softer or more relaxed grasp when you're trying to remove that tenacious deposit, you're likely going to burnish it. And this is more so for hand instruments. With your ultrasonics, you don't need all of that pressure. And if you are applying that pressure or holding your ultrasonic like you're holding a hand instrument, you're probably going to be doing more damage than you need to. So your poor grasp is going to increase chances of burnish deposit, more pressure, you are damaging the tooth. So this is a modified pen grasp. What thing I want you to be mindful of is that middle finger. Your middle finger should be down between the junction of the handle and the shank, but you should always have it on the side. You should never use the pad of the middle finger. When you use the pad of the middle finger, you get a 50% loss of power. So it's like a pillow. And again, when you don't have that pressure for those more tenacious deposits, you're going to burnish them. You must select ergonomically designed instruments. These ergonomically designed instruments are going to help you to reduce that pinch force, okay? When you reduce that pinch force, you can also help to reduce some of that lateral pressure, less stress on the muscles, and you're not going to be causing as much damage to the tooth surface. So a lot of instruments, the instruments that I was trained on, they were very thin, they were smooth, and they were heavy. And so it increased that pinch force. So ideally, you want to use instruments that have a balanced weight. You want to make sure that you are being mindful of the shank on your instruments. So if you're removing heavy to tenacious deposits, you want to make sure that you are using an instrument that has more of a rigid shank. When you are trying to get access into those deeper pockets, you want to make sure that you are using instruments with a longer shank. So those after fives, those longs, and sometimes minis. If you're using instruments with a big, bulky working in or a shorter shank, you're going to miss that deposit or burnish that deposit. And then, of course, you want to use instruments that are functionally sharp. That it helps to increase your tactile sensitivity, minimizes the stress and fatigue, so less strokes, and it's going to help minimize that lateral pressure. So we want to make sure that we are going to prevent those burnish deposits through fundamental principles. The fundamental principles, we've talked about some of them, but I also want to highlight the 3 A's. There are 5 A's that you need to concern yourself with, but the 3 that I really want to focus on is how we're adapting that instrument against the tooth, how we are going to angulate it, and then I want to focus on activation really quick. So we need to be mindful with angulation. Why is it important? If you're too open, you're going to bite into the tooth surface, and so you're going to cause damage. You could nick the root surface, so now you're creating extra, so you've damaged the tooth surface, but you're also created a new breeding spot for that biofilm. If you are too closed, meaning the angle is too closed, then your instrument is going to slide over the tooth surface and you're going to burnish it. So ideally, you need to be anywhere from 60 to 80 degrees. You want to be open enough where you can grab the deposit and effectively remove it. You also want to make sure that you are adapting the instrument appropriately. I really believe that you need to use instruments that fit the tooth surface that you're working on. So if you think of a big, bulky universal, something like a Columbia 4R4L, and you match that up against number 24, 25, that instrument is too big. For number 24 or 25, especially when there's no tenacious deposit, I absolutely would pick up a mini or a micro mini because I'm able to adapt that working in to the tooth surface a little bit better. So, and we also need to be mindful of that when we are going from the crown to the root surface. And then activation. We need to be using short 1 to 2 millimeter overlapping strokes. That is the same thing with ultrasonics. So people will often think, well, with ultrasonics, I can use a wider stroke because it's going to remove more. In actuality, you're not removing more. You're actually burnishing that deposit. So you're not necessarily saving time with ultrasonics. You do get additional benefits if you're using it appropriately, but you need to use short 1 to 2 millimeter strokes and make sure that you're overlapping. And if you look at a probe, you see what 1 to 2 millimeters, what it looks like. I would say if you were to go pick up a piece of graph paper, I think fifth or sixth grade is when they typically introduce that, those teeny tiny boxes, that would be 1 to 2 millimeters. That is what your instrumentation stroke should actually look like. And then you want to make sure that you are doing a more wrist rocking as opposed to finger pulling. And I'm exaggerating in this video so that you can see. There are definitely instances where you have to finger pull in areas where you just have limited range of motion. It is absolutely okay to finger pull. Finger pulling won't allow you the same amount of lateral pressure unless you're going to enhance or support your fulcrum. But also something to keep in mind when you are rocking, if you rock too much, you're going to close the blade and you're going to burnish that deposit. So make sure you're using a short rock. Don't rock your wrist like you're opening the door. Using horizontal strokes. So this is another thing not always taught in school, especially around line angles, those facial, lingual, or palatal surfaces. This is where you want to turn the tip or the toe down of the instrument. Line angles, that's where we miss a lot of deposit. It's burnished. So using those horizontal strokes along those line angles, very, very helpful. And then again, and I briefly touched upon this when we were talking about instrument handles, being mindful of the shanks that you are using, okay? Tenacious deposits, you want to have a rigid or extra rigid shank. Deeper deposits, you want to have a longer shank. So those are going to be really important things to consider. Quickly, I do want to talk about ultrasonics. There are definite rules that you need to follow for ultrasonics. It is so important that you select the proper insert to do the job. I didn't receive formal training on ultrasonics, so I've had to invest in a training post-graduation. But I can tell you that when I first started practicing, I turned the power all the way up high and I just used one tip. It is important to note that not all inserts are designed to handle all modes of power or applications. And like your hand instruments, you absolutely need to replace your ultrasonic tips. Using a dull or worn tip, you're going to burnish deposit. You're going to apply extra pressure because you're losing some of the efficacy and power with that tip. So that extra pressure in ultrasonics, there are several studies that actually speak to the amount of damage that can be caused with the ultrasonic if you are using dull or worn tips or excessive pressure. So we need to be careful with that. The same principles we have with hand instrumentation are the same principles we have with ultrasonics. The angulation is going to be different, of course, but in terms of adaptation and activation, those principles still hold true. Power is one thing that I want to bring your attention to. The higher the power, high power is designed to remove tenacious deposits, okay? Low power is designed to remove those lighter deposits in biofilm. So you always want to start on the lowest power needed to accomplish the task at hand. So if you just have biofilm or very light deposits, there's absolutely no reason why that power should be turned up, okay? You're going to cause damage to the tooth. And then again, replacing those tips. So tip wear, you get a loss of tip length, you get loss of efficiency with your worn tips. you have excessive pressure, you're burnishing the deposit, it's uncomfortable for you, it is uncomfortable for the patient. And there are studies that show that you actually could increase your scaling pressure by 40%. And pressure is not something that we want with ultrasonics. Understand that your patients are going to drive your tip selection. So do you know who you have in your chair? Are you selecting the same insert or tip every time? Do you consider your patient presentation before your selection? Are you using standard tips, slim tips, or ultra thin tips? So those all matter. So for example, with some companies, they have a line, they have a power line, and that's really designed to be used supergingerly on medium to high power. They then have ultra thin tips. So those ultra thin tips are almost 47% thinner than the power line. And those are designed to be used on lower power for deplaquing or very, very light deposit removal. So you have to be mindful of those things. What are some of the design features that mitigate damage? So a lot of the instruments, what I guess developers and manufacturers have done is that they've started exploiting the properties of metals. There's been so many advancements in metallurgy. So metallurgy is combining the science and technology of metals. Scientists are examining the microstructures of metal so that the engineers are able to predict and exploit its behaviors. There's been so many advancements in cryogenic processing. So that's where manufacturers are heating and cooling the instruments to make them more stronger and more wear resistant. So this is really, really important. I would say almost all of the newer hand instruments on the market, even some of the ultrasonic tips, are designed with these advanced metals. And in terms of the handles, even for your ultrasonics, if you look at the handles, they're larger in diameter, lighter weight, they're hollow. And I'm going to go back to hand instruments here. They're hand instruments, some of them are hollow. They have tapering near the shank and texturing and knurling. All of these design features help to reduce that pinch force. Again, pinch force, if you're pinching too hard, you're applying too much pressure, and that's never going to be a good thing. Also, with the advancements in metallurgy and cryogenic processing, we are getting instruments that are staying sharper longer, and each company has their terminology that they use to speak to this, these new metals, if you will, this new technology. So if we're talking about a stainless steel instrument, yes, you still have to sharpen that instrument. You just don't have to sharpen it as often. And then we have sharpen-free instruments where the instrument is staying sharp from one appointment to the next. These instruments don't last forever. And there's so many different factors that play into how long your sharpen-free instruments would last. The same factors that play into how long your stainless steel instruments will last. The key is that you want to make sure whether you're using a sharpen-free or stainless steel instrument, that you're using an instrument that remains functionally sharp throughout a commonly expected lifespan. We also have modified designs. So modified designs, or hybrid designs, if you will, clinicians saw a need. And so this is how we got extra rigids. We got the minis and the micro minis. And we've also been able to get instruments where they're combining area specifics, universals, or two area specifics together. And that helps to facilitate fewer instrument changes. Fewer instrument changes means less operator fatigue. Less operator fatigue, we're probably going to be more mindful of pressure. So things like the dual Gracie, this is one of my favorite, or the Syntec, this is from LM. So this is an instrument that combines an 11-12 and a 13-14. So if you take a look here, I'm often asked, well, what do you mean an area specific? This is an area specific with two cutting edges. You would start here on the distal, and you can see the movement here. And you simply turn to the opposite cutting edge, and you just work your way around. So American Eagle has a sharpen-free instrument. I believe it's a stainless steel. They have a double Gracie. I also know that Nordent has an instrument it's called a Scalette, but fewer instrument changes to me is the way to go. You always want to make sure that you're using a sharp instrument. Sharp instruments help you to remove deposit. Sharp instruments help you to decrease burnishing, less tissue trauma, less operator fatigue. So as we move on, after a dental visit, specifically scaling, the tooth surface will often find itself in a vulnerable state, stripped of the harmful deposits and the hydroxyapatite layer. So it's going to be exposed to potential sensitivity and further damaged if not adequately protected. And so in this post-treatment phase is where the role of the clinician extends beyond simply removing the deposit and stepping into the crucial realm of restorative care through the application of protective and remineralizing products. And so the goal is to fortify the tooth enamel, promote healing, and to provide a barrier against the assault of bacteria, which helps to ensure the long-term health and integrity of the patient's teeth. One way we can do this is through the use of fluoride varnishes. We know that fluoride varnishes are renowned for their ability to enhance the remineralization process and to assist in the replenishment of lost mineral content in the enamel. The varnish helps to create a durable protective layer over the tooth surface, seeping into those microscopic crevices to fortify the enamel. So there are so many different varnish products on the market. You have rosin-based varnishes. So your rosin-based varnishes have colophony in them. So if you have someone that has a resin allergy or rosin allergy, then a rosin-based varnish may not be the thing for you. So Profluoride is actually a rosin-based varnish. So what R&D has explained is that they actually have extracted the protein from the colophony. So you actually have to have the protein in order to trigger the allergy. So this is a rosin-based varnish that could potentially be used on someone that has a rosin allergy. But then we get into the realm of silicone-based varnishes and water-based varnishes. So the silicone-based varnishes and the water-based varnishes, they have removed the rosin. They have also removed the alcohol. So these are other alternatives to the rosin-based varnishes. We also have liquid varnishes. And so liquid varnishes can be very helpful. Prior to the silicone varnishes and the water-based varnishes, liquid varnish was definitely my go-to, especially for adult patients or patients with allergies to colophony-based materials. But before we end, I do want to talk about hydroxyapatite. Hydroxyapatite, again, is what the tooth surface is comprised of, and this is what's removed. So ideally, you want to use products that have hydroxyapatite in them. So here, over the next few slides, I want to focus on findings from Lineback et al. They did a systematic review and meta-analysis on the modes of action of particulate hydroxyapatite, and they emphasize hydroxyapatite's role in its remineralization capabilities. So what can hydroxyapatite do? It helps to form a protective hydroxyapatite layer. Hydroxyapatite demonstrates a strong affinity for both human and enamel, and it adheres to the tooth tissue and forms mineral bridges that help directly remineralize and protect teeth from acid attacks. So continuous application of hydroxyapatite in oral care products reinforces this protective layer, and it enhances the tooth defense against demineralization. Hydroxyapatite also releases calcium and is pH buffering. So again, hydroxyapatite not only forms a protective layer on teeth, but also integrates into the dental biofilm, releasing calcium ions and increases the pH of the biofilm when dissolved by the acids. So this process protects teeth by preventing direct acid attacks, remineralizes the enamel, and stabilizes the mineral surface of the tooth through the elevation of the pH. And so this enhances the defense against demineralization. Hydroxyapatite also helps to inhibit bacterial plaque adhesion. So studies have shown that hydroxyapatite mouthwashes actually reduce bacterial adhesion on dental surfaces as effectively as chlorhexidine without being bactericidal. So hydroxyapatite works by preventing bacteria from initially adhering to the teeth, with bacteria instead binding to the hydroxyapatite particles in the saliva. And so this action reduces biofilm formation and the risk of acid-induced demineralization. So again, this offers a non-bactericidal method for maintaining dental health. And then last, we get deep remineralization of carious lesions with hydroxyapatite. So clinical studies demonstrate that hydroxyapatite toothpaste or creams effectively prevent dental caries by promoting a more uniform and deeper remineralization of the surface compared to fluoride. What I love about hydroxyapatite is that the particles penetrate the tooth micropores, and they help to attract the calcium and phosphate ions for the new crystal formation. So that helps to support the enamel and dentin regeneration. And this offers a different approach to dental health. So this is something that you definitely want to do post debridement. I wanted to quickly show you this picture here. So here what you see is the effect of hydroxyapatite nanoparticles on enamel remineralization. And here, the white arrow here shows an area that has not been infiltrated by hydroxyapatite crystals. The black area is the area that has been filled in. So this just gives you an idea of how hydroxyapatite penetrates into the enamel. In recent years, there has been the emergence of nanotechnology in dental products, the nanotechnology or nanohydroxyapatite, if you will. These products closely mimic the natural composition of tooth enamel. So these nanohydroxyapatite-based products can effectively fill in those microscopic enamel defects. So not only does it help to reduce sensitivity, it helps to promote a smoother, more resilient tooth surface. And this is what we absolutely need post debridement. So there are a couple of products on the market. ReminPro, this has always been my go-to. The ReminPro also contains, there's lots of products in addition to the ReminPro that contains xylitol. And the reason why I'm saying that is that I always look for products that do more than one thing. But, you know, these products that can contain the nanohydroxyapatite will help to strengthen that dental enamel and actually put back that hydroxyapatite layer that was lost post-scaling and root planing. So ultimately, what you want to do is you want to protect your patient and you want to master your technique. The elemental and mineral composition of enamel and dentin is a testament to the sophisticated natural engineering of our teeth. So for dental professionals, a deep appreciation for this composition underpins every effort to maintain the integrity of the tooth and minimize damage during routine procedures. So through careful practice and a commitment to preserving these vital structures, we can help ensure that our patients' teeth continue to serve them well throughout their lives, embodying the strength and resilience that nature intended. So while routine dental procedures like the scaling and the polishing are essential for maintaining health, they can temporarily affect the hydroxyapatite in our teeth. So understanding these impacts allows us to appreciate the importance of skilled dental care and the body's remarkable ability to recover. So remember, regular dental visits, we still want to stress that, but we take those regular visits combined with good oral hygiene, good technique, and products to help mitigate the damage. We can ensure long-term health and the strength of our patients' teeth. So I want to thank you so much for attending this webinar this afternoon or evening. And now we'll take time to answer any questions you may have. Let's see here. Let me go to the Q&A. So the first question is, would nanohydroxyapatite toothpaste be better than fluoridated toothpaste due to it being an integral part of the natural composition of enamel? Yes, it could be, and I think it depends on the nanohydroxyapatite paste that you use, but what I'm finding is that the majority of them will include fluoride as well. Someone says, greeting from Qatar. Wow, well, hello, thank you for joining us. Love the slide of a tooth. Where can I see or get one like that? I believe this was a Canva photo or an Adobe stock photo, but you have to purchase it on Adobe. Next question. Let's see. Do you polish the tooth with hydroxyapatite paste after scaling? You absolutely can. Another thing that I found helpful is that when you have time, because some of us have a little bit more time than others, when you're doing your oral health education session with your patient, some people do it before they scale. That would be a time that I've taken the product like ReminPro that has the hydroxyapatite in it, And if it was something that I'm going to recommend to my patient, of course, you always want to show your patients how to use that, because the RemenPro is a cream. So you want to show your patients how to use the cream. So in using that cream, I'm already providing some extra protection for the tooth prior to my visits, but you absolutely can use it after scaling, because it's less abrasive than some of your prophy paste. So that was a great question. Any advice on adapting instruments in patients who do not open wide or who do not move their heads towards you? That's a great question. I worked in nursing homes for 4 years, and unfortunately, there are some patients that simply can't open their mouth. And in those situations, you oftentimes have to compromise your body, especially if they're wheelchair bound or they're bed bound. But in those instances, you want to make sure that you maybe have somebody with you, you have an assistant. But if you're in private practice, let's say, where they can't move their head or adjust their body, you don't want 8 patients in a row. Somehow stagger those patients so that you're not continually compromising yourself. Are there any mail-in sharpening companies that I recommend? The only company that I know, there have been some that I've run across going to different conferences, and I haven't heard anything bad about a sharpening company. I know certain instrument companies do offer a sharpening program, free sharpening for the instruments. So Norden is one of those companies. Depending on which instrument handle you purchase, they will sharpen that instrument for free for the life of the instrument. Do the nanoparticles penetrate I'm going to assume that you mean the enamel, or are you talking about the tubules? But yes, they do. So post-debridement scaling, what is the product that you recommend most often? It depends on who my patient is. So again, it's not a one size fit all. It depends on who my patient is in the chair. So for someone who has an extreme amount of sensitivity, I would probably recommend a product that I didn't talk about here. So for some patients, just a routine, debridement, a simple varnish or a liquid varnish would work. But for someone who's having extreme sensitivity, then I would recommend another product. Admira Protect is a product I would recommend. Will the restorative check with an Explorer damage the tooth structure and spread caries? Will insurance cover post-debridement varnishes? So some insurances, yes, depending on the narrative and depending on the code that you use and how you're using the code. So coding is another presentation in itself. In terms of the restorative check, when you're doing a restorative check with an Explorer, that's an assessment. So with an assessment, you shouldn't be using a lot of pressure. So you really ideally wouldn't be causing any damage. And can you spread caries? Yes, if you're using the traditional stick method, from one occlusal surface to the next, you actually can spread caries. Is RemenPro okay for people with dairy allergies? Yes, thank you. Wonderful class. Are teens and young adults treated the same as adult and much older patients as to calcium phosphate treatments and fluoride applications? Well, I feel like some teens have adult mouths. So it depends on what you mean by young adults. And what I would say is that with any product, you always need to follow the manufacturer's instructions for use. They are going to tell you, for instance, for fluoride varnishes, whether you're using an adult dose or a kid dose, you need to do that based on the age of the child. Is there any over-the-counter hydroxyapatite toothpaste that you recommend patients can use daily? RemenPro is the only one that I use. You get that from your dental office, but I'm sure that there are others out there. Again, the RemenPro. Would hydroxyapatite help with demineralization from bad oral hygiene with braces? Absolutely. And I'll just tell a quick story. I found RemenPro because I had white spots. I had white spots from bleaching. And so that RemenPro definitely helped to remineralize and get rid of those white spots for me. So I kind of found the RemenPro on my own. Thoughts of piezo versus Cavitron, and I think you mean piezo versus magnetostrictive. They both work equally as well. So if you read the science You'll have people that say piezo works well, people that say piezo works horribly. Some people will say magnetostrictive works well. Some people say it works horribly. Two very different techniques, and I think that you should use the technique that works best for you. I usually sharpen my instruments for each patient. Is this too much sharpening? As long as you're using a fine grit, I do not think it's too much sharpening as long as you have a good technique. So those were great questions, guys. Thank you so much. And I do want to be mindful of time. If you have any additional questions, feel free to message me, email me. My information is here on the slide, but I look forward to joining you in a future presentation. Thank you so much.